अस्सलाम वालेकुम या कनाब्दू व या कनस्ताइन। वेलकम टू माय चैनल डॉक्टर शामी सेज। तो आज की इस वीडियो में रेडियोलॉजी का मैं पोर्शन स्टार्ट करने जा रहा हूँ। रेडियोलॉजी 20 नवंबर आफ्टरनून पेपर। क्वेश्चन नंबर 1, द मोस्ट रेडियो सेंसिटिव ट्यूमर इज़ द ब्रेन स्टेम ग्लायोमा। क्वेश्चन नंबर 2, 18-year-old गर्ल with the bicarnate uterus is most likely due to which of the following abnormality? The paramesonephric duct. The girl with the cyclic lower abdominal pain every month with the amenorrhea presented to you. PA exam normal, hymen ring normal, cause would be the cervical atresia. Question number 4, the urorectal septum separates the rectum and the urogenital sinus. Next, question number 5, TRALI or TRALI occurs within the 6 hours, trolley or trolley, whatever you may pronounce it as. Question number 6, the osteonic canal running obliquely and transversely connecting the medullary cavity with the cortex is the Walkman's canal. The epithelium of the salivary gland is derived from the ectoderm. The putes orange appearance of the breast occurs in the malignancy of the breast due to the distortion of the suspensory ligament of the breast. The route of the spread from the breast cancer to the peritoneum, liver, and the pelvic organs is the venous communications. CSF examination necessary to rule out the retinoblastoma melanoma of the eye. Patient with the hydrocephalus CT scan brain shows dilated ventricles. Cells between the blood-brain barrier and the flood would be the endothelial cells. The site of the bone marrow biopsy in the infants would be the tibia. The bone marrow biopsy is done at which of the following site? That is a ventral iliac crest. The woman after artery was brought to the emergency where she was intubating and transfused blood. After a few days, her HB got down from 12 to 8. An endoscopic gastritis in the gastric ulcer were found. What is the reason behind the gastritis? The bicarb and the chloride. Shift the patient from the hilly stations having the labor pain. SCG done. Fetus normal. Which abnormality can be seen here? There is the PD. The child presented with the dark colored nappy, dark urine, and the homogeneous oxidase deficiency, which what likely cause the result alkaptonuria. The child presented the dark nappy. Again, that is the same MCQs. This is alkaptonuria. The scrotal lymph drainage will be the superficial inguinal lymph node. The lymphatic drainage of the tumor at the anal verge is superficial inguinal lymph node. 60 years old male presented the OPD with the complaints of hematuria, increased urine frequency in the DRE. There is a stony hard mass felt, that is prostatic. Lymphatic drainage of it would be internal iliac in the sacral. The patient with the anterior two-third tongue carcinoma. What is the lymphatic drainage? That is the submandibular nodes. Which hormone are use the phospholipase C as a secondary messenger, that is the thyroxine. The betel nut chewing leads to the following disease: the submucosal fibrosis. A pregnant woman at the time which type of the anemia occurs, that is the iron deficiency anemia. 24-year-old lady who is 6 months pregnant complains of generalized weakness and lethargy. RHP is 9.8, MCV is 58, and MCH 15. Serum ferritin level 150. Diagnosis would be the thalassemia trait. Next, 26, the infant with the rudimentary hand, the foot with the irregular small bones. This is likely the Phecomelia. Newborn baby is born to a 20 years old primary gravida. On examination, the baby has the amputated limb. The most likely cause is the amniotic bands. The pregnant lady with 41 weeks 5 days pregnancy anxious requested for the induction of the labor. Postpartum pregnancy by WHO is called at the 40 weeks completed. The pregnancy stuck at which phase of the menses? That is the follicular phase. The cytotoxic T cells cause the immune reaction by the interleukin. The patient came with the underdeveloped left face and the chin distorted external ear, and the ramus was abnormal X-ray. The cause is the mandibular dysostosis. The chest drain passed to the lower border of the rib caused damage to the intercostal nerve. Which of the following prevents the collapse of the lung? That is the intrapleural pressure. The bullet hit a person from superior iliac region and goes out at the fourth lumbar region. There was the massive blood on the laparotomy, which major vessel is hit at the root of the mesentery, that is IVC. The carcinogen cause mutation. These genetic mutations are acquired. The patient having the pleural effusion on the microscopy, lymphocytes, macrophages, fibroblasts, and epithelial cells found. This is due to type of inflammation, that is the granulomatous in esophagus. From the squamous to the columnar transition occurs at the level of the esophageal gastric junction. Next, the person is having history of smoking, drinking from many years. In the endoscopy, there is a mass in the middle third of esophagus. What could it likely be? The squamous cell carcinoma. Next, the smoker working in the tire factory came with the hematuria. Cause of the urothelial carcinoma would be the smoking. The patient with the uroporphyrin 1 in the urine diagnosed with the congenital erythropoietic porphyria enzyme deficient is the uroporphyrinogen 3 synthase. The 4-year-old boy was attended in the clinic and was observed to have the short neck, low hairline, and the posterior aspect of the neck, and was known to be suffering from the heart condition. X-ray showed the fused cervical vertebra. Fused cervical vertebra, that is the feature of the Klippel-Feil syndrome. 42. The female with the short stature, hand swollen, and amenorrhea, and secondary characteristics sexually absent. That is definitely the Turner syndrome. 45X nullo. 40 years old female. The chances of the Down syndrome would be 1 in 100. X-linked recessive disorders are less likely in the males present at the heterozygous for the X gene. Next, which one is directly related to the coronary artery disease? That is the LDL-C. After transfusion, acute reaction occurs. Management is the adrenaline in the population of the true positive. Among all those who are actually true positive is the positive predictive value. Mod is the most observed value. Which drug has the shorter half-life and the given in the infusion? That is the dopamine. The carbagelene mechanism of action is the D2 agonist. The policeman was sent to you because of his urine has some opioid and other drugs found. What will be his response? That is denial. The hepatitis most likely progress to the chronic liver disease. That is the hep C. Which of the following hepatitis spread commonly by the blood transfusion? Hep B. Vaccination schedule for the hepatitis is 0, 1, 6 months. The climber at the high altitude experience hypothermia on returning to the base camp, adapts to cold weather by the heat generation due to which of the following? That is the posterior hypothalamus. Which one directly control autonomic reflex system of the body? The hypothalamus. The patient cannot adduct his fingers is due to the damage of which of the following nerve? That is the ulnar nerve. The person who is unable to button and hold pen to the damage of which muscle? That is the median nerve. The person got stabbed on upper arm and the floor of axilla. Which of the following structure will be damaged? The intercostobranchial arteries. Aortic pressure is highest at which phase of the cardiac cycle? The rapid ejection phase. The hypospadias is due to the abnormality of the urogenital folds. The thymus originates from the endoderm of the third pharyngeal pole. The chromatic reflux carried by which nerve? That is the genitofemoral nerve. Afferent fibers of the chromatic reflux are carried by the ilioinguinal nerve. Child having the Meckel's diverticulum is having the bleeding per rectum. It is due to the ectopic gastric tissue basically here. The baby prefer feeder instead of mother breast due to cleft soft palate. As a resident in the pediatrics, you are called to see a newborn who has a unilateral cleft lip and unilateral cleft of the primary palate. This condition is most likely the result of the failure of the vein of the maxillary prominence with the medial nasal prominence. The mechanism of the tuberculin test is the antigen presenting T lymphocytes. 25-year-old patient having the depigmented skin lesion on the back, lips and the cheeks. There is a family history of diabetes. What is the suitable pathogenesis of this disease? That is the autoimmune. Middle-aged woman with the increased TSH, low T3, T4 and having overweight, most likely due to the hypothyroidism. The patient with the Addison disease present in the emergency with which complication? That is the hyperkalemic paralysis. The mineralocorticoid secreting tumor serum finding will be the hypocalcemia. The patient presented with the pain in right hypochondrium, nausea and the jaundice. The pain is going to the shoulder region and the upper back. Which condition is associated? That is the cholecystitis. Next, the stab wound in the fifth intercostal space, which is 4 cm. Damage of the structure would be the pericardium. The pain of pericarditis is carried by the pharyngeal nerve. Diaphragm is not formed by the ventral mesogastrium. Female with the UCD complains of heavy bleeding. On examination, basophil colonies are seen. Which organism is involved? That is actinomycetes. The chronic fungal infection with the rhinosinusitis causing medial erosion and granulations is by the Aspergillus. 79. The 40-year-old man came in the ER with the complaints of body weakness and oliguria. He gives history of the taking some drug for weight gain from the journal Quack. Urine detailed report. Urine specific gravity is 1.010. Urea creatinine is raised. ALT and the calcium is raised. The likely diagnosis is the nephrocalcinosis. The newly married female came with the right iliac fossa pain. Her TLC is 12,000. She has fever and the vomiting. LMP 3 weeks back. Likely diagnosis is the appendicitis. The type of flood due to the appendicitis is the exudate. Husser's membrane from the hypoblast will make a boundary of the exothalamic cavity. The patient suffering from the generalized edema and the frothy urine. Biopsy was done and there was but pink foam cells in the tubules. This is done the absorption of the proteins. The patient is having rhinosinusitis and nasal polyp, the fungal invading lamina propria, excessive endothelial damage and the having non-septate hyphae. Non-septate hyphae, that is the muco. 1 creatinine ratio greater than 20. The cause would be prerenal azotemia. Next, the own inspiration, which cardiovascular parameter decrease, that is the decrease in thoracic pressure with the dilatation of thoracic veins. Riboflavin combine the phosphate to form the FAD and FMN. Correcting one hernia is due to the defect in the fascia transversalis. Ductus deferens differs from others due to having three muscle layers. The vessel at the base of the bladder lies in which ligament, that is the dorsolateral. The child X-ray showing the unilateral hydronephrosis. What is the cause behind it? That is the pelvic ureteric junction obstruction. The ascent of the horseshoe kidney is prevented by the inferior mesenteric artery. The teenager playing with the gun suddenly injured at the right side, just lateral the rectus dominus at the level of ninth intercostal cartilage chip. Structure injured most likely in the abdomen would be the fundus of the gallbladder. Decrease in the lymphatic flow is due to the increased plasma-oncotic pressure. 95. Reader can be damaged at the pelvic brim while ligating the ovarian artery. The percentage of maximum storage of the iron is the ferritin. The patient presents with the pain in the lumbar region, stone at the pelvic ureteric junction, pain arising from which segment, that is T12 and L2. Next, features common to all type of the shock is the tissue hypoxia. Most important factor leading to the decreased wound healing is the tissue hypoxia. 11-year-old boy having the polydipsia, polyphagia, polyuria, weight loss with the fasting hyperglycemia. What is the diagnosis? That is IDDM. Inferior parathyroid is supplied by the inferior thyroid artery, which the falling nerve is damaged during the ligation of the inferior thyroid artery. That is a recurrent laryngeal nerve. Next, 103, the 85-year-old male with the complaint of the lower back ache. Doctor during the examination noticed outgrowth with the tuft of hairs at the L5. What is your diagnosis? That is the spina bifida occulta. The child born with the mass at the lumbar region with meninges without neural tissue in it. This is due to the spina bifida with the meningeocele. Patient post-hysterectomy develop hoarseness of voice. Examination reveals sluggish movement of vocal cords. Nerve damage would be linked to the middle medulla. There are hemisection of the vertebra which will be lost contralaterally, that is warm. The regarding the ductus arteriosus, the closes at the birth due to the muscle contraction. Next, 109, the ductus arteriosus is present between the right pulmonary artery and the aorta. 110, the Ig antibodies present on which of the following: the mast cells lung volume remain in the lungs after normal expiration, that is FRC. 112, the medial attachment of the flexor retinaculum is the pisiform bone. The person who is unable to button and hold up pen with the damage of which muscle, that is the opponent's sprained ankle resulting from the excessive inversion most likely demonstrates which structure damage, that is the lateral calcaneal ligament. The 115, the greatest saphenous vein is approached at which side? The posterior to the medial malleus. The powerful supinator of the forearm is the bicep brachii. Heavy bleeding after injury between the base of first and second tarsal bones. Which artery is involved? That is the dorsalis pedis. The injury of the adductor hallucis artery is related to the dorsalis pedis. Nerve supply of the medial plantar side of the foot would be the tibial nerve. The aspirin at the lower doses inhibit which of the following? That is the inhibit thromboxane 2. The patient has the history of fecaluria. Which structure separates the bladder and the rectum? That is the Nunvillers fascia. Next, the protein synthesis occurs in which organelle? That is the rough endoplasmic reticulum. Vessel at the base of the bladder lies in which ligament? The dorsolateral. The patient has the infarct of the left ventricle, which is subendocardial, and the infarcted are also infarcted. Intraventricular septum, most likely. What is the cause? That is thrombotic occlusion of the LCX. 17 years by, there is ecchymosis on the small injury with only increase in the CT and all the investigation normal. The cause would be the non-thrombocytopenia purpura. Surgeon was repairing tip of the femoral hernia sac. Which vessel is at the risk of injury most commonly? Superficial epigastric artery. Which one passes greater sciatic foramen? That is the piriformis. Next, 128, the hyperextension of the neck diagnosed at the hangman fracture in which there is the fracture of odontoid process of axis. 129, the epidural anesthesia was given to the pregnant female. Ligament parts at the last during the epidural would be the ligamentum flavum. Vitamin D activity is assessed by the 25 hydroxycholecalciferol. The dopamine regulates which one? That is the prolactin. Next, the first 2 centimeters of the duodenum supplied by the which artery? That is the right gastric artery. During cholecystectomy, which artery will be damaged? That is the cystic artery. The patient had enema in ECG, ST elevation to 3 AVF. Okay, so that is the RCA. The during endoscopy, 32-year-old woman ulcer found the posterior wall of the stomach. This is likely to cause bleeding due to the splenic artery. Next, the patient presented with an ability to write, read, and understand. Most likely the lesion is in the Wernicke area. The man unable to hold a mug of coffee. An image draw of the shoulder and the hand movement on which part of the brain? That is the premotor cortex. Nerve damage between the C5 and the C6 would be C6. Young boy with the repeated RTA has the bronchopulmonary sequestrations which will show anomaly in the segmental morphology. Which one is regulated by the vitamin D? That is the serum calcium. Next, male present the OPT with the 104 fever last 4 days, gives history of using antimalarials. passing cola color urine for the last 1 day with decrease D and LFTs and increase in conjugative bilirubin. What is the cause? That is alpha, which is the G6PD deficiency, the actin adhere to Z line through the actinin. The difference between the smooth and the striated muscles will be the calcium calmadelin complex. After vagal stimulation of the heart rate slows down. Permeability of the SN node is increased by the potassium. Next, 145. The tetanus toxin is the neurotoxin. The young patient present with the jaundice. The investigation will high serum ALP and the decrease HB and decrease reticon. The total bilirubin is 6 and the conjugative bilirubin is 5. Most likely the cause of the jaundice is the pigment stones. Rhythm and the motility of the GAT is maintained by the calcium potassium channels. The relation of the terminal CBD with the head of the pancreas is the posterior kidney, because the outer cortex and the medulla, from which epithelium renal parenchyma is formed, that is the mesothelium. 150. The vein accompanying left circumflex artery is which of the following? That is anterior cardiac vein pain, the gluteal region, most likely arteriosclerosis of which vessel? The internal iliac. The anterior two-thirds of the interventricular septum is supplied by the LAD. Next, the patient after vaginal delivery developed the fecal incontinence, likely damage to internal anus sphincter. Suitable investigation is the anal manometry. The lymph nodes related to the descending and the sigmoid colon is the inferior mesenteric lymph nodes. Which one of the following is true about the heart? That is the LCA gives LCX in the lad person doing chin up, raise his arm above head and then bring rod in front on the chest. Which muscle helps? That is the latissimus dorsi. Local lymphatic obstruction is called the combination of which of two infection? The neoplasia. Next, 150. The patient after vaginal delivery develop fecal incontinence, likely damage to the internal anal sphincter. The suitable investigation would be the anal myometry. The 154. Lymph node related to the descending and the sigmoid colon of the inferior mesenteric lymph node. 155. So the following is true about the heart. That is the LCA gives LCX and the lat. A person doing the chin up, raise his arms above. I have already done few of these. I think I am doing them again. 158. The hypocalcemia leads to which effect on the heart? That is a systolic arrest. Next, in nephrogenic diabetes, what will occur? That is the ACF osmolality increase in the venous tone to the right atrium is due to the increase in the mean systemic filling pressure. The patient has LRTI for many days. On histology, respiratory tree, which of the following will be damaged? That is the cilia. The CSF finding necessary to rule out which carcinoma, the retinoblastoma, from lower to the higher gradient by the carrier mediator is the facilitated diffusion. The medial ward, the Escherichia fossa, is formed by the levator ani. Next, 165. The major blood supply of the perineum is from the internal potential artery. 19 years old female with increased tags. Which in the following series condition can occur? That is the pancreatitis premalignant, and for the oral SCC is the submucosal fibrosis. Intrinsic damage, which factor cause an activation of the coagulation? That is the factor number 12. The muscle that is attached to more than one joint and that prevents excessive movement of proximal joint is called the fixator. The part of CBD include the supraduodenal, intraduodenal, and the retroduodenal. Which of the following tumor for lowers the Knudsen 2 hit hypothesis? That is the retinoblastoma. 69 years old male got blood brain tumor. On biopsy, there was the fibrillary acidic protein substances found in the brain tissue. Which one of the following is the marker for the above mentioned proteins? That is the astrocytes. Which change will be seen first in the response to the stress? That is increase CRF. The disoriented old patient was brought in the emergency by the wife complains of right flank pain, vomiting. Diagnosis of appendicitis were made and urgent appendectomy was Jesse. Patient did not give consent for the surgery. Next step would be to take consent from the wife. Most common site of the rib fracture is the just anterior to the angle of the rib, and the thiazide act on the DCT. After bone marrow transplant, best cell for the engraftment includes the stem cells. The biological activity of the immunoglobulin is due to the FC portion. 155. That is the scenario of the steatosis. 180. Respiratory steatosis occurs in which of the following? That is drowning, splaining, ventilation course in the superior to the body and the tail of pancreas. 183. Patient with the nephrotic syndrome, which structure in the GBM plays major in the perm selectivity for the proteins? That is the lamina arena. External source of spread of infection to and from the tip of nose occurs through which of the following? There is a superior ophthalmic vein. The patient presented in the semi-conscious condition with subclavian steal syndrome. Blood supply to which artery is causing this condition? The vertebral artery wing of scapula occurs due to the involvement of which muscle? There is a serratus anterior. Young male has azoospermia and initial investigation would be FSH and the luteinizing hormone and the testosterone levels. The surgeon with the performing splenectomy, there was a massive necrosis in the fundal region of the stomach. Short gastric arteries would be injured. The EDV depends upon the venous return. The patient has ataxia when asked to walk with closed eyes, sways back and forth when there is a lesion present at the dorsal column. There is the hemisection of the vertebra. What will be lost contralaterally? That is the warmth. Next, 192, the female with the heart disease, downward traction of the A valves cannot be made. Which structure is damaged? That is the chorda tendon. Next, last mass in the ligamentum arteriosum would compress. D, there is a left recurrent lunge nerve. So that's it from this particular paper. Thanks for watching my video. There were a bit of distractions in this particular video, so sorry for that. Until my next video, Allah Hafiz.